Home is where most Canadians spend most of their time. Home is supposed to be a safe place. It's your refuge from the world.
Housing is an important determinant of health. I mean, you want to have a roof over your head, you want to have a healthy environment, you want to have a safe and comfortable place to come home to at the end of the day, and all of those things contribute to health.
Smoke-free policies in community housing are consistent with the objectives of community housing, to provide clean, safe living spaces.
Waterloo Region is a municipality of about 550,000 people, made up of 3 cities and 4 townships. It's a large rural population, but yet a very heavy urban concentration as well.
The region of Waterloo owns about 3,000 units of housing throughout the region of Waterloo in all 7 area municipalities. We've got everything from single-family units to townhouses to apartment units. You can be looking at about 6,000 to 7,000 people in those units.
I began to get calls from tenants in many of the buildings saying, we are bothered by the smoke, we're seniors, or we've got other health issues and the smoke in the building is bothering us, can we stop it in our building?
Whereas we used to deal with them as one-offs in buildings and try to come to some sort of mediated agreement, it really didn't get to the root of the problem, which was people were smoking in their units, and regardless, smoke gets out.
We know that secondhand smoke transfers from one unit to another. It can get into units through hallways, through doors and windows, from patios and balconies, spaces between walls.
Several times in the evening when I would be getting ready to go for bed, I'd love to have my window open, but I didn't because smoke would drift in from my neighbor's patio. So I was isolated with no fresh air because the smoke was coming in there.
Secondhand smoke is a known human carcinogen. It's also been identified as a toxic air contaminant. There is no known safe level of exposure to secondhand smoke.
Secondhand smoke is a primary risk factor for lung cancer. Secondhand smoke is a risk factor for other forms of cancer as well as cardiovascular disease. And recent evidence has shown that even short-term exposure can be harmful to people's health.
Both public health and housing departments were asked to come together to begin work on this policy. The consultation process started initially with a tenant survey. Tenants who responded to the survey let us know that they do smell secondhand smoke in their units, and a significant number of tenants told us that they are bothered by it and that they also have health conditions that are worsened by their exposure to that secondhand smoke.
Doing nothing really wasn't an option, and if we applied the policy to only certain of our housing units, then obviously that would create clear inequities. It seemed most reasonable to apply the policy across the board.
A policy that regulates a person's home is difficult, but I think this policy really speaks to the issue of justice and health.
There is no absolute legal right to smoke, not federally under the Canadian Charter of Rights and Freedoms or under provincial human rights legislation.
This policy doesn't mean anyone's denied community housing. What it means is that there are specific rules.
Seniors do not adjust to changes that well, and they're going to say this is a free country, why can't I smoke? I think their health is more important than a cigarette.
While we do legally have the right to include no smoking provisions in new leases, we can't unilaterally amend existing tenancy agreements, and therefore existing tenants will be grandfathered, so to speak, in that they will continue to be able to smoke in their units.
So we sent out letters to every household on the wait list, and we said this is the change in policy.
Wait list usually is anywhere between 3,000 and 4,000 households. That's not people, households.
We had only 5 responses who said we want to change our choices.
We bought ashtrays that are placed strategically at the 5-meter mark away from our buildings. We also have painted lines there, so it quite clearly shows tenants where they can and cannot smoke. And we also posted signage, and the signage can be seen when you approach the buildings.
We know that smoke-free policies have other benefits, including helping people to quit, encouraging them to do so, as well as cut back.
Even if someone isn't initially thinking of quitting, when they're exposed to smoke-free spaces, it moves them further along to actually thinking about the possibility of quitting.
Policies like this do help people like me want to quit and be able to stay quit because we can't smoke inside. So you do reduce based on convenience.
In about 5 years, we figure about half of our units will be smoke-free. So in 10 years, we expect to have full turnover.
We also had researchers from the university involved from the very beginning.
The evaluation of this policy has been very comprehensive. Propel at the University of Waterloo conducted a series of air quality studies. So we measured secondhand smoke in common spaces of different housing units within the portfolio of Waterloo Region Housing.
An interesting finding from the policy evaluation was that many of the smokers said that they are now going outside to smoke as well, even if they're not required to.
Several of my friends who live in the building who did smoke in their unit respect the fact that I want to live in a smoke-free environment and have stopped smoking in their unit.
There are lots of really strong reasons for adopting a no smoking policy. Less cleaning, less maintenance, less painting.
To go in and retrofit an apartment unit for somebody else coming in where you had a heavy smoker can cost us $5,000 quite easily per unit.
I think for us, the key to its success is because we had tenants involved from the very beginning.
Don't be daunted. Explore. The fears can be allayed very quickly if you do the process right.
Canadians are ready for smoke-free housing.
You can take the Waterloo Region Housing experience and apply that to your own community.
We've had a long history of doing good policy development in this region. This is one I think will stand up over a period of time and one we'll all be very proud of.